Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. Total cases remain at 294. As of this morning, there are no cases in hospital or in ICU. 273 individuals are listed as recovered. There are 14 active cases. Yesterday, 1,115 lab tests were performed. Our total lab tests performed to date is 42,306. We've been able to gradually increase our gathering sizes, but physical distancing is still critical. We see this virus is still in our province, and we need to find ways to continue to reopen successfully, but being aware of this virus. And those ideas remain the same right from the beginning, and that's to wash your hands frequently, to try to maintain that physical distancing whenever possible, to avoid large, crowded settings. And very vital to our success moving forward is to stay home when you're ill. We've all battled through those colds before. Our new normal doesn't allow that. We can't have people showing up to work or to school or to groups with symptoms of respiratory illness. So please, if you're ill, stay home. Do present for testing. Our testing criteria is open to all symptomatic Manitobans. So even if you have very mild symptoms, fever, cough, sore throat, headache, fatigue, even if you're not sure, go for testing. Our capacity to test is there, and this will allow us to identify cases early, isolate cases early, as well as perform contact investigations. And it's going to be key to our success moving forward, because we're not done with this virus. We're still going to need to deal with this virus, be aware of this virus, but we've put ourselves in a very good situation right now to continue our success, to continue the gradual reopening of Manitoba. So those who are at increased risk of severe outcomes, those over age 65, those with underlying medical conditions, those with respiratory or cardiac condition, those with immune compromise, need to be extra careful. You need to limit your exposure to others, certainly avoid large group settings, wash your hands frequently, but because of the additional risk, you need to take extra caution during this time. So in Manitoba, we've seen that our testing numbers continue to climb. Our testing capacity is there. We have the ability to identify cases early. We have the ability to contact trace. We've seen that the rate of positive tests in Manitoba continues to be quite low. Over the last 5 days, it's 0.07%, so quite low. We haven't had any cases in the last 7 days that we can't link to travel or to close contact of a known case. So all of these factors have really set us up to continue our success with the reopening plan. So I encourage all Manitobans to stay safe at this time, and really thank Manitobans for being able to put us in this position to continue our success moving forward. And our success is going to, again, rely on Manitobans' ability to be aware of this virus and to follow these guides. So thanks again, and I'll pass it over to Lanette.
Lanette Siragusa. I'm the Chief Nursing Officer with Shared Health, and I would like to start today by congratulating the Children's Hospital Foundation of Manitoba. This is normally the weekend where families gather together in Assiniboine Park to celebrate the Teddy Bears Picnic. And the pandemic, of course, means that this is not normal business. But the Children's Hospital Foundation has determined that the show must go on. The Teddy Bears Picnic is occurring this year virtually, with families invited to join in on the fun by logging into the Foundation's Facebook page. There will be videos on how to set up your picnic space at home. There'll be suggestions on healthy snacks for parents to make. And of course, there'll be teaching on how to make a cast for your teddy bear or bandage up if there's an injury. So congratulations to the Children's Hospital Foundation for their creative efforts in continuing on with this tradition. And we hope to see everybody at Assiniboine Park next year. We are approaching the time of year when many Manitobans make plans to spend time at the cottage, including some who relocate for the summer. And we want to encourage all summer visitors to be safe at the cottage, on the water, and don't travel if you're ill. Hospitals, emergency departments, and emergency response services around the province are there for you if you need them, but we want to make sure that this summer is a safe one. The influx of seasonal residents to some areas is top of mind as regions are considering the staffing implications to ensure that they can return services to normal for their residents, and that also summer visitors have access to timely care if they need it. This isn't an easy task because some health regions, like Interlake Eastern, for example, see their population increase by thousands over the summer. So for Manitobans who rely upon home care services and who are planning on traveling or relocating to a community in a different health region, we encourage you to check with your home care program before you travel and to work with them to make arrangements in the region that you're going to. As we cautiously move forward into the next phase of our response to this virus, health regions throughout the province must give priority to resuming services for their permanent residents, but health regions will also give consideration to requests for seasonal residents on a case-by-case basis. Some services may be reduced or less frequent than what they normally would get, but some may not be able to be accommodated. So the health regions will consider and assess their ability to increase those services, and we appreciate the understanding of all Manitobans during these unprecedented times. I want to talk a little bit about emergency department wait times. So we continue to see a significant reduction in patient volumes in our emergency and urgent care centers throughout the province, resulting in historically low wait times. In Winnipeg, there was data that was posted yesterday showing that the median wait times for April was only 38 minutes. And there are likely several factors that are at play as to why this is happening, and we will be analyzing this data more in the weeks ahead. But in the meantime, we do want to encourage everyone, if there are reasons you need to seek medical care, you need to absolutely do that. And all the precautions are in place at our facilities to safely welcome you there and take care of your needs. So please seek those out. And finally, I want to provide a quick scheduling note on some of the community testing sites in the Prairie Mountain Health Region. Effective this weekend, the Dauphin and Swan River sites will be closed Saturdays and Sundays. The Brandon drive-through site is also going to be closed on Sundays going forward. Several other sites throughout the province remain open this weekend, and any Manitobans who have symptoms should go and get tested, and to go to the manitoba.ca/COVID-19 website to check in on addresses and hours of operation. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one opening question and one follow-up question. Up first this afternoon from CBC Manitoba, Aidan.
Good afternoon, this is Aidan from CBC News. My question is for Dr. Roussin. I'm wondering, can you give us any more information on the two cases that were announced yesterday? Are they linked to any other known cases or travel or to lead to community transmission?
Yeah, so it appears those two cases are linked to travel. So I don't have any more details to share on that, but the investigation is leading to identify them related to travel.
Okay, thank you. And my follow-up is, we have a story today about a gentleman who is in hospital dying, and his family has been told that they have to wait until he is very close to death before they're allowed to visit him. Their concern is that they aren't able to provide comfort to him right now, and when they are able to see him, they clear that he will be so sick he doesn't recognize them and he won't be himself anymore. So what is the rationale for making families wait until patients are at that point to allow the end of life visit?
So right now, the guidelines do consider compassionate reasons, and at each site, the clinical team should be looking at a case-by-case basis who is able to visit. And we absolutely understand these are difficult times, and we are looking at the visitor guidelines specifically for palliative care, but also we are exploring acute care and how we can accommodate more visitors. So those plans are in the works. It does take some operational changes as well if we do it on a bigger scale. Just in terms of screening visitors and making sure we have the staff in place. And so we absolutely understand the difficulties that this presents, and I would encourage families to talk with the sites and see if there can be accommodations made on based on the circumstances of the individual.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I'm sure you've been following some of the news in other provinces. There's one outbreak in Saskatoon that caught my eye in recent days, and it involved two large family gatherings. These were believed to, at least one of them was believed to have been outdoors. Does this outbreak give you pause at all in terms of the reopenings and the public health orders that you have in place?
So I don't have a lot of details about that particular outbreak, but I think that we've always said is we're not done with this virus. This virus is still in Manitoba. You can see that we still detect cases, and Manitobans need to get used to seeing cases here. And Manitobans need to continue to take precautions to prevent the transmission of this virus. And so large gatherings, prolonged close contact, certainly indoors in closed spaces is worse. Outdoors, the transmission seems to be less likely, but large groups, close and prolonged contact can certainly see that transmission there. So certainly this we're not returning to normal. We need to keep taking these precautions because we can still set ourselves up for events like this. So, given our numbers, given the low rate of transmission that we're picking up now, given our capacity to test, to contact trace, I think we're still in a good position. And I think Manitobans realize just that we've put ourselves in a good position, but we're not returning to normal. We still have to be very wary of this virus as we move forward.
And at this point, can you comment at all on the potential timing of phase 3 of the reopening?
It'll be much the same, ideally when we make big changes, we'd like to have 2 full incubation periods to look at. So we're looking at 3 to 4 weeks. And so certainly that would be a good place to start thinking about where phase 3 could be implemented. Certainly, just like in phase 2, we were able to get ahead of it a bit. We were able to increase group sizes. So we're constantly looking at this. We'll look at the effects of phase 2, and just like what we've done up to now, as soon as we feel it's safe to loosen restrictions, we're going to do so.
From CTV Winnipeg, John.
Hello, it's John Hendricks from CTV News. My question is for Dr. Roussin. We're hearing that there may be added or further guidelines being imposed for gyms and spas to implement before opening on Monday. If so, can you please tell us what they are?
Yeah, so there's, we're looking at providing guidance for different health or different industry sectors. So we want to be able to provide specific guidance. So there really isn't any changes to our, the orders that we had put forth that was in the document. But as we get more and more questions, as we get more inquiries coming in, we'll continue to update our guidance to ensure people are well aware of how to protect themselves and protect their clients.
So can you tell us what those added things guidance is?
Well, I don't know if there's anything that I would consider significantly changing anything. We're, all of the processes are in place again, that 50% occupancy, one person per 10 square meters. There's probably guidance on, how to ensure spacing in locker rooms and things of that nature. But I'm not aware of any real substantial changes to the past, just more guidance to help operators continue to protect themselves and the clients.
Okay, thank you. My second question is for Lanette. I'm just wondering how outdoor visits are going at long-term care facilities. I'm wondering, are all up and running, and what safety precautions are being taken?
Yeah, so my understanding is that some PCHs were able to open their doors for outdoor visits earlier than today. Today was our target date that all were going to be available, and I haven't heard that anyone's behind that target, so I expect that they would all be open. They will have different strategies from an operations perspective depending on the physical layout of the PCH. So I know some are scheduling visits, some are just having a drop-in time. We've had really positive feedback from patients, their families, residents. So that's been good. We know we're moving in the right direction when we get that positive feedback. And I think there are either volunteers or supervisors who are just making sure that they're managing the flow of people and keeping up with those cleaning precautions.
From the Winnipeg Free Press, Danielle.
Good afternoon. Danielle Disposa from the Winnipeg Free Press. My question, I guess, is for Dr. Roussin first. You said the two cases that were announced on Thursday are connected to travel. Can you tell us whether the individuals were close contacts to each other and perhaps where they had traveled to?
Yeah, so they were close contacts of each other and both related to travel. And so, but that's all the details that we're issuing now. So the, our advice is to limit travel outside of Manitoba. There's certain, exceptions to that. But this continues to be Manitoba's biggest risk is importation of the virus. In this case, everything was done correctly, and there's likely very few contacts to these cases.
Thank you. You've also said previously today that Manitobans should become used to seeing new cases in the community. I'm wondering why should Manitobans feel confident about their health and safety when new cases are announced with very little information, as was the case on Thursday?
Yeah, so the information that we announce is to inform Manitobans, and any time that there is information that we have that should make Manitobans change their behavior or be aware of something that should affect their behavior, then we're definitely going to announce that. If we're dealing with, say, a workplace that has cases in it where no members of the public have been exposed, there's no benefit to Manitobans to list that. If we have people who are traveling, who have no other contacts, and our advice is already to not travel outside of Manitoba, then listing, precise details doesn't benefit Manitobans. So we're certainly going to share information, and we have when we think that it's going to benefit Manitobans.
From Global, Merrick.
Hey there, Merrick DeCash, Global News. My question is for Dr. Roussin. We've heard that 2 weeks ago a restaurant was planning on holding live music. They were told by the government that they couldn't do that. Now we're seeing restaurants that are opening up in the next week or two are advertising live music. In phase 2, will they be permitted to have live bands inside the restaurant?
Yeah, so there's a number of factors with these type of things. So we have occupancy limits within restaurants, and so anyone in there will, in this case, would count towards that. So if they had, performances going on, that's going to count towards the 50% occupancy limit. We've advised against singing and things just because of the droplet formation and risk of transmission there. So, it's all going to, we're going to have some guidelines out in that regard. But again, we want to limit close, prolonged contact in these situations. So that's why we're going to have that 50% occupancy rule. And if there is performances such as this, it's going to certainly count against that rule.
And my second question is just because I don't think phase 2 specifically specifies the following thing I'm about to say. In places of worship, like churches, synagogues, stuff like that, will they be able to resume in-person services?
For sure. So the group size limitations have always applied to places like faith-based organizations. So right now there's a few options. So the 25 indoor is certainly an option. The 50 outdoor is certainly an option. And then there is also the option that doesn't have a limit on the occupancy, which is the drive-up services. And so I would note that in places that have larger facilities with completely separate rooms, if groups are completely cohorted, that they have either separate entrances or coming in at different times, and there's no intermingling between the groups, then you could have more than one group of 25 within the same structure as long as they're kept separate in separate rooms. So there are some options going on, and we're working with a lot of the faith-based organizations now to see what we can do in the near future to try to get get their limits up in a very safe way.
From the Brandon Sun, Kyle.
Hello, this is Kyle Douglas from the Brandon Sun. I had a question for Ms. Siragusa. You mentioned that I believe the testing sites in Swan River, Dauphin, and Brandon are reducing their hours. They won't be opening on Sunday again, if I recall correctly. Can you explain why this is in place?
So the weekend numbers are usually low. I would say in Swan River and Dauphin, overall the testing volumes have been lower than other sites. So as we've always said, we need to keep evaluating where the demand is and shifting where we can best meet the need of the public. So this is just announced for the weekend, but we will always be looking at those testing sites, how we can change them, how we can make them better, and how locations like MPI and also potentially others may need to be relocated as people come back to work. So we are always going to be assessing that throughout this COVID response.
So you just feel comfortable that you don't need to do it, for example, daily at the Brandon Town Center, which is why you're taking Sunday off in that respect?
Well, it's just for, I think, this Sunday, and same with Swan River and Dauphin. It is this weekend, but we are looking going forward based on the demand and the resources. How can we best make sure that people get access to the testing, but really do it in a responsive way. So, and it may be to operationally, I'm not sure what the staffing situation is in Prairie Mountain, but that might also be a factor as well.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, as you said, the 2 men who reported as testing positive yesterday contracted the virus through travel. Can you say they traveled out of province, out of the country, and had they been self-isolating when they became symptomatic?
Yeah, so I'm not, at this point, I don't have a whole bunch of details to share on the exact travel, but it certainly was outside of Manitoba, and it does appear that they became symptomatic shortly after return, and really outside of household contacts, there doesn't appear to be any other contacts.
Okay, and just as a follow-up, I've heard some concerns from teachers as we head into phase two, especially in school divisions that are reopening a bit more aggressively. One educator says they're kind of only offered masks if they request them for certain close contact, prolonged situations with kids who might need a little extra help, but that's not going to be an N95 mask. The kids are not wearing masks themselves, so they're not going to be protected themselves as much. What advice would you have for teachers who are being expected to work closely for prolonged periods of time with students who might have a few extra needs, who likely don't understand distancing and who want to stay safe?
Yeah, so a couple of issues there. So the N95 mask is really never required in the community. N95 mask would only be required for aerosolizing procedures, and those are the type of things we see in the medical area. So there wouldn't be a need for a teacher in that setting to ever really use a N95 mask. And then so in the setting, and certainly with where our numbers are now, there's some advantages to that setting is that the screening. So all students and all staff should be screened for symptoms moving into there, and no one showing any signs of illness should be allowed. And then certainly physical distancing may not be possible at all times, but other than brief exchanges, that physical distancing can still be often maintained between teachers and students, frequent hand washing. And so masks, if we think about masks, certainly in the in students and things, you know, masks and PPE, the biggest issue with them is they must be used effectively in the correct manner and consistently. And so, you know, in those settings, it's going to be really unlikely to really expect good compliance in younger people. But where we are right now in our transmission, what we know about masks, what we know about the other factors that we have in place to protect people, the PPE is really not required in those circumstances. So the screening, the hand hygiene, the physical distancing are what's most important.
From the Winnipeg Sun, Scott.
Hello, Scott Billick, Winnipeg Sun here. Question for Dr. Roussin. Has the incubation period timeline changed at all since start of this, or at least the number of days after the post symptoms where a person it isn't as infectious or is far less likely to infect somebody else? Has that changed at all?
Yeah, so there's two aspects to it. So the incubation period is the time when you are first exposed to the virus to a time when you can develop the disease, and so that we've always used 14 days for it. We haven't seen that change really. Certainly evidence that probably the majority of people will show symptoms within 10 days of being exposed, but we have that 14 days as a safety factor. And then the other is the duration of infection and infectivity is what you're talking about there, and so we've always said that somebody who is without symptoms and at least 14 days after symptom onset, we will no longer consider them infectious. What we know is it's probably less than that. It's probably 8 to 10 days, no symptoms after onset of symptoms, that they are less likely to be infectious, but we have that 14-day as to be cautious to ensure that we're not releasing people from isolation when they might still have some infectivity.
Okay, thanks for that. And second question, just we've obviously seen an uptick in cases this week, or not cases, sorry, tests. We've had symptomatic testing open for now, maybe it's close to a month now, at least 3 weeks. Are the majority of these tests now this week asymptomatic, or what is the reason why more people are being tested right now?
Certainly a significant component is asymptomatic testing right now. I don't have a recent, or I don't get a daily breakdown of that, but certainly the targeted asymptomatic testing is contributing to increased test volumes.
From CBC Radio Canada, Mohammed.
Hello, Dr. Rosen. It's Mohammed from CBC Radio Canada. As a follow-up for testing, you wanted to reach 3,000 tests per day in the summer. Are you still following this goal?
Yeah, and so what's important is to have the capacity to do so. So certainly by entering into fall, I think it would be nice to have the capacity to be able to do 3,000 tests a day. Certainly when you get a positive test rate of 0.07%, we don't really want 3,000 tests being done a day with a detection rate of that. It's really not a good use of our resources. So for us, it's the ability to test symptomatic people and the ability to ramp up testing should we see an increase amount of the virus.
Thank you. As a follow-up, considering the low test rates in the province, are you worried about the second wave of COVID-19 here in Manitoba?
So, a couple issues there. So, I mean, I think the positive test rate is low right now. We're following a number of indicators, and so we still know we're detecting this virus. We still know that we're at risk of importing the virus. So we're going to closely watch all of these numbers, and so we could see increased cases. But we think Manitobans are going to do their part to limit that kind of spread. And then with pandemics, with these type of viruses, in the past we often see that there's been more than one wave, and so we certainly are preparing for future waves of this. But no one can know for sure if that wave would be coming, or what that wave would look like, or when it would be here. So certainly we are preparing for a second wave that could be in the fall, and it could be at the same time as influenza. And so that's why we get the message out now that this year we're really going to be encouraging that flu shot. We need to ensure Manitobans are protected against the severe illness that the flu causes, the one that we actually do have a preventive measure against.
Thank you. We have a few minutes left for a few more questions, so if our reporters on the line have any further questions, please proceed.
Hi, Aidan Geary from CBC News. Dr. Roussin, on those two cases linked to travel, can you say if the travel was domestic or international, and also if the travel was for professional reasons or personal reasons?
Yeah, I don't have a whole bunch of details to share on that right now. What we do know is that it was travel, and that these individuals were contacts with each other, and sure doesn't appear that there's been any substantial other contacts in Manitoba.
Were they self-isolating as required to when entering Manitoba, though, that 14-day self-isolation? Sorry, Diana from CJOB.
Yeah, I don't have a whole bunch of details on that. The details I do know is that this was their symptomatic, and that the only contact we could find was a household contact.
John Hendricks from CTV. Dr. Roussin, given this travel-related, and New Brunswick also dealing with an outbreak due to travel to Quebec, should there be stronger measures to prevent interprovincial travel?
I don't think for Manitoba, I think we've had these travel restrictions on. We certainly have the international travel restrictions. We have travel, limitations that people domestically have to self-isolate for 14 days, with some exceptions. And and I think our numbers have shown, and these these cases show that people are taking that serious in Manitoba. And because our numbers are much different than some of our neighbors, we're going to have to continue to have those limitations on travel. But I think that people are following advice, and we'll continue to watch that.
Dr. Roussin, Diana from CJOB again. Just quickly, what is your advice to businesses that want customers to come in only if they are wearing masks? Are businesses allowed to do that?
Well, I think that a business could certainly implement policies. My advice is that not to use the masks as a distraction. That ensuring people who are ill aren't going out shopping, people who are ill aren't working at your establishment. setting policies up to ensure physical distancing, available hand hygiene, far more important than wearing masks. And so if people want to choose to wear masks, again, it doesn't protect yourself, it protects people around you. You have to be careful and use them appropriately. And so I use that as a permissive option, something that people can consider, but it's got to be in addition to all of those other factors.
Danielle from the Winnipeg Free Press. I'm wondering, Siragusa, when the first batch of those silicone reusable masks might be expected to come into use in the province?
That is a good question. I will check on where they are at with the production and distribution. I haven't had an update recently.
And that concludes today's media briefing.
Thank you.
Thank you.